What's your question?
Well, I don't think the 1 in 4 is correct. When you say 1 in 4 does not get health care, everybody in the United States gets health care. I don't see a hospital turning down a legal alien even.
I don't know. I'm not been hanging around the hospital a lot, but I do know that nobody that's not legal in our country is afforded health care.
Of course
that's in the law.
Of course they
are. A long time. And,
wait a minute.
Well, anyway, and also
it's common
we heard
practice.
now let me finish on this concern. Lois Capps, who happened to be one of my colleagues, went to Congress when I did, is on the Commerce Committee, I believe it is, and she was able to get it just to make sure that there was something like this came up, even though it's already the law in this draft bill. That's what it is. We don't have a final bill yet, as you know. I trust you know that, which I'll say just a couple words about it. We don't have a final bill, but the language in this draft bill that came out of Commerce says that this care will not be offered to anybody that's not legal.
It's in the bill.
So they'll be turned away?
No, it's in the bill.
I'm sorry, what was your last?
Then you're telling me if I'm an illegal alien and I go to Mercy Hospital in Des Moines, they say you're illegal, so you're not going to be able to come into emergency and get
That might be something we need to check into.
It's on page 50 of the bill, section 152.
Well, I think section 252 it is, if I remember, says that you can't treat anybody that's illegal. I'll read the section 252 as I remember from my reading, but I don't have the bill here in front of me. I think it's section 252.
I'm telling you, it's in section 152.
Through no fault of my own, I had very good insurance for a lot of years, and I was laid off, and now I'm working again, but that person can't afford, a small business person, can't afford to provide me insurance. I can't get insured because I've been ill for 4 years. I am absolutely the poster child for why we need a public option, and I'd encourage you Congressman, and all your compatriots to support this, because I need health care.
Well, on the public option, I think we're going to have a public option. We'll get to more people if we don't do that because we've got limited time. Now, let me finish. I don't just say give me a blank piece of paper in a public option. Now, we have that for years, to me, some abuses have been going on our state on Medicare reimbursement rate. And we're down for, we all pay the same, but we get the least, we're very, very efficient. We do a good job. But other places across the country, and I don't want to take up a lot of time because there's so many questions, but they get double what we do. And it's not right. So if this thing goes to the Medicare reimbursement rate, I don't think that serves us well. So I'm holding out on that part of it. But I do know there's a number of places across the country, talking to colleagues and so on, that there's no competition. And so I don't think there's...
So they price me out is basically what it is. I can't
well, there's a need, but it's got to be right. It's got to be right. Got to be well thought out. Okay, what do you have?
Right here, Congressman.
Thank you, Congressman, for coming. I'm Bill Hudson from Pella, Iowa. I'm a retired civil servant and a retired United States Marine Corps. I am disabled. I have 3 insurance companies that I currently deal with. I have free access to medical care through the VA. I have totally rejected that. I hate it. I will not rely on it. I'm paying for insurance and I use that. I cannot imagine going to the public option. But I would be more willing to do so if you and the rest of the representatives would be willing to do so also.
Well, as we got into talking about the early part of this, the HR 3200, which is the draft bill, which got lots more process to go through, is really patterned after the insurance that's available to me and my staff. In fact, all federal employees. No, it is. That's the pattern. Now it's not in its final form, but that was the goal, the idea that that can be done. So it's working in that direction. So you're trying to. And by the way, thank you for serving the Marines.
Congressman Boswell, I'm Stacy Picard. I'm a constituent from Knoxville. No one asked me to come here today, and I wrote these remarks myself.
Yes.
Under the proposed healthcare reform bill, all Americans will be required to participate in a qualified plan or face stiff penalties. The President-appointed Health Choices Commissioner will establish all health benefit standards for these qualified plans. Oversight and management of all qualified plans will be done by a committee of 27, I believe, presidential appointees. Those in line for these president-appointed positions are Dr. Blumenthal, Dr. Ezekiel Emanuel, who have written extensively in favor of comparative effectiveness analysis, including cost-effective analysis. Comparative effectiveness analysis alone is not a bad thing. Comparative effectiveness analysis compares different treatments for the same disease to determine which treatment is the most effective. This is helpful information for doctors and patients as they make decisions about their health care. However, cost-effective analysis, which is advocated by Drs. Blumenthal and Emanuel, means deciding whose lives are worth the cost of certain health benefits and whose are not. I believe, and I think you do too, that most Americans do not want their government to have the power and control to make cost-effectiveness decisions for its people. I especially believe they do not want this power and control to be concentrated to a president-appointed council. I have a 3-year-old son with spina bifida. My son does not walk, he uses a wheelchair, and he faces a lifetime of health concerns. He is happy, he is smart, he is the light of my husband's, my other 4 children, and my life. He is the joy of our family. In the Netherlands, where cost-effectiveness analysis and quality of life analysis are the rule, we would have been advised to euthanize my son at birth. This is the slippery slope we are headed down if we allow our government a foot in the door on cost-effectiveness analysis. No one was going to start euthanizing anyone anytime